Next, I'm going to talk a little bit about heart health. Many of you understand that the heart is a very important job in your body because it's literally pumping blood throughout all the tissues in your body and helping bring oxygen and nutrients to your tissues. But did you know that the heart is literally pumping 2,000 gallons of blood through it each and every day? It is one of the strongest muscles you have in your entire body. 2,000 gallons a day, that is a lot of blood. So what do we do to improve our heart health? Well, as many of you would have guessed, probably exercise is one of our number one important things that we can do to improve the quality of our heart and our circulation throughout our body. Now, there are many nutrients also that are super important. In fact, DHA and EPA needs to be taken to 2,000 milligrams a day minimum just to protect our heart and our vessels and our brain. Our brain is mostly composed of that. And so if we're not having enough DHA and EPA, that's one of the first things that I want you to start doing with your diet. A good barometer to know if that is an issue for you. If you lose your hair, if the back of your heels, the skin starts getting dry and chapped, those are big deficiencies of EPA and DHA. Now also CoQ Heart, that's another great nutrient that brings more oxygen to the heart muscle. Also vitamin D plays a huge role. Now you could have blood work done and you could say you have a 20% decrease or increase in the LDLs, which are the lousy lipids that you don't want, and that puts you at maybe a 20% higher risk of having a heart attack. Did you know that if you're deficient in vitamin D by 20%, you have over a 250% more chance of having a heart attack. So vitamin D plays a huge role in our heart health as well. Just as much as exercise and everything else is important, making sure that you have the right nutrients to promote healthy heart and have healthy heart habits, all of these things play a huge role in your overall picture if you're going to get heart disease. Now, one of the other things, if you do have heart disease that runs in the family, I'd recommend getting an EBT scan. This is electronic beam technology, which is about 75% less radiation than a CAT scan. But they would do that of all your coronary vessels, and they could tell you how much calcium has built up in the walls of those vessels. That puts you at even more risk than all the other health risks together. So, if you have a poor diet, and you're not processing your food well, calcium can build up in the artery walls, and then they're not elastic and they can't expand and contract when they're pushing the blood through it. So this puts you at very high risk of heart disease. Now we have a lot of great solutions between the nutrients we already mentioned to also melatonin. We have high dose melatonin pills that can actually reverse that calcium cardiac score. So if you're somebody that suffers from cardiac issues, if it runs in your family, I urge you to get some tests done. We do a cardiac stress test where they run you on a treadmill, inject some dye and run again, and that way they can see where the dye gets. If you have any blockages in those tissues, we can find that very easily. But more importantly than even that, I think the EBT scan is going to serve you the most. I personally do one of those each and every year, and that helps as a barometer to know, is my diet right? Can I add anything else to try to improve those scores? And can I reverse them any further than I've already been reversing them? And so if cardiovascular health and heart health is important to you and your family, we actually have another video of a full presentation to teach you all the different things that we can do to help your heart health, and that is right below this video. So feel free to watch that at your leisure and have a great day.